Well, good afternoon, everyone. Thank you for being here. My name is Zach Child, and I'm Health Projects Director at the Pulitzer Center. And I just want to say a few words about the partnership between the Pulitzer Center and the Johns Hopkins School of Public Health as part of our Campus Consortium program. Of course, I'd like to thank Dean Clagg for his leadership and support, along with Brian Simpson for helping to develop this partnership, and Jackie Frank, who has been instrumental in getting these panels together. The Pulitzer Center is a nonprofit dedicated to promoting international journalism and engagement with global affairs. I know I don't need to tell you that there is perhaps no issue facing our world today that is more complex and as in need of good reporting as public health. So a major part of our work at the Pulitzer Center is partnering with schools like Bloomberg to connect students that are investigating rigorously these issues and connecting them with leading journalists who provide mentorship and perspective on communicating these issues effectively, accurately, and passionately outside of these walls to broad audiences. This is the second Bloomberg School Campus Consortium year for us. Last year's symposium focused on the role of media and public health in reporting non-communicable diseases. And this year, we focus on HIV and human rights challenges facing key affected populations. Our partnership also allows for student fellows to undertake international reporting projects with the support of Pulitzer Center staff and our network of journalists. So last year's Hopkins student fellow, I don't know if you're familiar with Varsha Ramakrishnan, but her reporting on dowry violence in India won a 2014 Robert F. Kennedy Journalism Award and a 2013 Society of Professional Journalists Mark of Excellence Award. And this year's student fellow, Michelle Furng, is currently on assignment in Peru, exploring the plight of the elderly in a rapidly aging population. We are exceptionally proud of this work and of your students, and we're really looking forward to the future of this collaboration. So if you'd like to learn more about the Pulitzer Center or have ideas about future symposia or reporting projects in mind of your own, I'd love to talk to you after the event. But now I'd like to introduce Chris Beirer, who has been a huge guiding help in developing these panels and supporting this event. He is the Professor of Epidemiology, International Health, and Health, Behavior, and Society at the Johns Hopkins Bloomberg School of Public Health. He is also the director of the school's Center for Public Health and Human Rights and associate director of the Center for AIDS Research and of Global Health. Dr. Beirer is a member of the Scientific Advisory Board of the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, and co-chairs the U.S. National Institutes of Health Office of AIDS Research Planning Committee on Epidemiology and Natural History. Also in 2012, he became president-elect of the International AIDS Society and will serve in this role from 2014 to 2016 of the world's largest body of HIV professionals. Dr. Beirer's research interests focus on the burden of HIV and other infectious diseases and the association with human rights, with specific interest in epidemiology among higher risk or marginalized populations, prevention research, and molecular epidemiology. So I can't imagine a better host for this afternoon's events. Chris Beirer, thank you.
Well, good afternoon, everyone. Welcome to the second Johns Hopkins Pulitzer Center Symposium. This actually is the second event. We had a wonderful showing of the film The Abominable Crime last night, and I think some of you were there. So our partnership with the Pulitzer Center through this campus consortium makes it possible to raise awareness of global health issues through excellent journalism informed by public health knowledge and research. This year's focus and the title of the symposium, as you just heard from Zach, is Human Rights and HIV, Public Health, the Media, and the Fight Against Stigma and Discrimination. So in the past 3 decades, we have had an extraordinary response to the global HIV epidemic. There are now more than 11 million people worldwide on antiviral therapy. HIV deaths have been reduced, and we have seen steadily declining rates of new infection in some of the most affected countries, including many of those in sub-Saharan Africa. I wish I could tell you that the U.S. is one of those countries with declining rates of infection, but we're not. But there's an important shadow over the HIV response in many of the world's countries that is really threatening our victories against HIV, and that is a wave of punitive and discriminatory laws and policies that make it difficult to, or impossible, to work with key populations, which includes people who sell sex, people who inject drugs, men who have sex with men, transgender persons, and making it harder and harder for those people to obtain essential services and to live their lives with dignity. 78 countries criminalize homosexual sex. The death penalty is on the books in 7. More punitive laws and policies have been debated and been passed, even in countries like Nigeria, where gay sex was already illegal. And the evidence is clear that when people are threatened, feel afraid, when these laws and policies are enacted, when the media in those countries plays into the stigma, discrimination, that this really interferes with the fundamentals of public health, with provision of services, and aids and abets the HIV epidemic. So that is a real problem, and that is one that is going to take, I think, a partnership of the media and science, of public health and journalists. Today we'll hear from international journalists who've done in-depth reporting on this urgent global health issue, and from faculty at the school who are producing research that quantifies the scale of this epidemic, and that really, as I said, is threatening 30 years of progress. We're going to have the first panel, and to introduce that panel, we're going to have our moderator, Joanne Rosen. So let me just briefly introduce Joanne for those of you who don't know her. She's Associate Director of the Clinic for Public Health Law and Policy in the school's Department of Health Policy and Management, so a member of our faculty. She served as counsel to the Ontario Human Rights Commission in Toronto for 17 years in her native Canada, and she appeared before tribunals in all levels of Canadian courts, including the Supreme Court of Canada. She teaches a very important course here at the school on give us the exact title. I love that title.
Legal and public health issues in the regulation of intimacy.
The regulation of intimacy. I mean, amazing and very, very important. So without further ado, Joanne.
Thank you, Chris. That was very nice, and it's nice to get a shout out for the class, for the course, which is 4th term for the students who are here. And I will in turn give a shout out to Chris and Tonia's class momentarily. So I am the moderator for the first panel, and the topic for our first panel, as you can see from the pamphlet, is the cultural, legal, and policy landscape for key affected populations. We are going to focus on 4 particular populations: gay men and other MSM, or men who have sex with men, transgender persons, people who use drugs, and sex workers. Each of these populations is vulnerable to stigma, discrimination, and marginalization on 3 separate but closely related fronts, what I would call the triple threat of stigma. First, these populations are vulnerable to discrimination and stigma on the basis of their minority status, because they are gay men, because they are transgender, because they are people who use drugs, because they are sex workers. So they are vulnerable because of their minority group status. Second, and separately, they are also vulnerable to discrimination and stigma because of their HIV status, either actually being positive or the perception that because of their inclusion in one of these higher risk groups that they are HIV positive. And finally, members of these groups are vulnerable to discrimination and stigma because of the unique intersection of being both members of minority groups and being perceived as being HIV positive. Joining me on our panel, and going to join me on the stage momentarily, are Professor Tonia Petit, Maurice Tomlinson, and Daniela Zalsman. Tonia is an assistant professor here at the Bloomberg School in the Department of Epidemiology. Previously, Tonia served as the senior advisor for key populations in the Office of the U.S. Global AIDS Coordinator. She focuses on issues of LGBT health and pays particular attention to transgender health disparities. Together with Professor Chris Byrer, Tonya has pioneered a course here on sexual orientation, gender identity, and public health. The course was taught for the first time last year and was a fabulous success. I sat in and audited the course, so I can attest to that firsthand. And it will be taught again this year in our second term. So now is the time to think about us if you haven't already. I know that's shameless. Tonya's research has taken her around the world, but we were very lucky here that the School of Public Health is the place that she calls home. This afternoon, once our panel commences, Tonya will talk about the structural barriers to attaining good health that are faced by transgender women, by sex workers, and by people who use drugs. The second of our panelists is Maurice Tomlinson. For those of you who were here last night to watch the tremendously disturbing and tremendous film, The Abominable Crime, Maurice is familiar to you already. He is a Jamaican lawyer, a longtime LGBT rights activist, and an educator. He is working now as a facilitator with LGBTI Aware Caribbean, an organization that provides sensitization training to the police, healthcare providers, media workers, and other stakeholders in the Caribbean response to AIDS. Maurice courageously launched a lawsuit to challenge Jamaica's strict anti-sodomy laws. When he married his husband in my hometown of Toronto, the story of his marriage was picked up by Jamaican newspapers. It appeared on the front page of papers, and he found himself outed as a gay man. As a consequence of this, and proof of the very difficult circumstances for members of the LGBT community in Jamaica, he received multiple death threats and had to leave Jamaica for his own safety. Maurice's story, as I mentioned, was vividly chronicled in last night's documentary. He currently teaches law at the Ontario Institute of Technology, and Maurice received the inaugural David Cato Vision and Voice Award in recognition of his work defending the human rights and dignity of LGBT persons. This afternoon on our panel, Maurice will talk about the impact of homophobia on the HIV epidemic from a Caribbean perspective, as well as his experience with strategies that are aimed at ending this virulent homophobia. And our third finalist is panelist and finalist. Yes, it's a pageant here today. Right, she's cheering, she likes that. Is Daniela Zalzman. Daniela is an award-winning photojournalist based in London, New York, and Uganda. She has worked for the Wall Street Journal, the New York Times, Sports Illustrated, Time, and Vanity Fair, among other publications. Her photographs have appeared in exhibits throughout the US and Europe and form part of the permanent collection of the Museum of Fine Arts in Houston. Daniela holds a degree in architecture from Columbia University, and one of her images, an image of John, a Ugandan LGBT activist, has been seen probably by many of you on the flyer that the School of Public Health circulated for this symposium. This afternoon, Daniela will talk about the responsibilities and the challenges that are faced by journalists, especially visual journalists, in raising awareness about LGBT rights. We're very fortunate to have Tonya, Maurice, and Daniela with us today, and I invite them to join us on the podium. When each finishes speaking, we will have time. We've set aside time for Q&A, so if you don't mind, I'll ask you to hold your questions until we get to the end of the formal presentation.
As you can see by my confusion on how to get up on stage, I'm going to be very formal. Thank you, Joanne, for those great remarks. I really appreciate it. I made a few notes, but I'm really interested in leaving in the conversation that we're going to have, so I'm going to be relatively brief, and I think everyone else has planned to be brief so we can really engage with the people who are here. As Joanne mentioned, the populations that we're here to talk about face enormous stigma and discrimination on multiple fronts, and there are some populations who experience stigma and discrimination who have a large advocacy community behind them, and I would say that sex workers and people who inject drugs in particular, as well as in some places LGBT communities, do not have access to those kinds of advocates. And I know that Danielle is going to talk about the media, but I think that's one place where we can strategize around how to build momentum for advocacy for these marginalized populations that often, even if people are supportive, they're not willing to be so publicly, and therefore not willing to push their leadership, their government, to do more for these populations. So as Joanne mentioned, I'm going to speak specifically about sex workers, people who inject drugs, and transgender folks. So as most of you know, most countries criminalize sex work, including the United States. One of the consequences of the criminalization of sex work is that it's harder to do HIV prevention and harder to access treatment for these populations. In particular, in the US and other places, when sex workers carry condoms, and even people who are not sex workers carry condoms, often that's used as evidence of sex work and used to criminalize these populations. So you can see that already there's a barrier to prevention. It also means that because these are considered marginalized populations, that when sex workers experience physical violence and sexual violence, either at the hands of clients, at the hands of partners, or at the hands of the police, they often have no recourse, because when they go to the authorities, they're seen as criminals and therefore don't have access to justice. Recently at the International AIDS Society Conference, we were fortunate enough to be part of a project with the Lancet that looked at HIV and sex work in a series of papers looking at sex work among female sex workers, male sex workers, and transgender women. And one of the most important findings, I think, out of the series was that decriminalizing sex work has a huge impact on improving HIV, reducing HIV incidence among sex workers. So this was a modeling study. Nobody's done it and then followed prospectively. But I think that's a really important finding, that when we think about HIV prevention, that we think about decriminalizing sex work as an important aspect of that. Our own government, in fact, has policies that make it more difficult to provide services for sex workers. You might have heard about the prostitution pledge and the Supreme Court decision around that happened a few years ago. So previously, the US government required that organizations that provided services, HIV services to sex workers, sign a pledge that they did not support the promotion of sex work or the decriminalization of sex work. The Supreme Court overturned that for US-based organizations, but not for international organizations. And it didn't change the policy that the US government does not fund organizations that promote sex work. And so promoting decriminalization of sex work is considered promotion of sex work. So you can see the disconnect between the science and between the policies, even if in our own government. We also know that most countries criminalize drug use, including our own country. Criminalization of drug use, and particularly criminalization of injection drug use, leads to populations hiding their drug use, and in particular not being able to access services that we know are effective, including needle and syringe programs. Methadone maintenance treatment programs are available in the US, but they're frequently not available in other places. And we know that methadone maintenance treatment programs are effective, but needle and syringe programs are less expensive and require less infrastructure to put into place. Since the 1990s, there's been lots of evidence on how effective these programs are. And even in our city of Baltimore, if you look at trajectory of HIV prevalence among among drug users, you'll see that after the needle and syringe programs are put into place, we saw a dramatic drop in the incidence of HIV among drug users here in this city. However, the US government bans the use of federal funds for needle and syringe programs. We had a brief window last year where this ban was overturned, and because of political considerations, it was reinstated. So there continues to be a ban on US government funding for one of the most efficacious interventions that we have for people who inject drugs. There are some countries that criminalize cross-dressing, and that's often used to target transgender women. There are many countries that use anti-homosexuality laws to target transgender women, because there's this conflation of sexuality and gender identity, and there's this misunderstanding of transgender women as men who have sex with men. So frequently they're subject to legal sanctions based on that as well. Importantly, there are very few countries that provide protections based on gender identity. Fortunately, here in Maryland, we were able to pass a law just this past year that provided legal protections based on gender identity. But most places around the world don't have that. And they also don't have processes in place for transgender women who want to change their legal documents to match their current gender. And that leads to all sorts of downstream problems in terms of employment and housing. So you can imagine if you're going for a job, and you present with ID that doesn't match how you look, then that's a huge barrier. If you present with a gender marker that doesn't match what the Social Security Administration has for you in the United States, that presents a problem for employment. If you started your employment looking like a male and later look like a woman, frequently you experience stigma discrimination on the job, and often people lose their jobs in relation to that. So those kinds of limits around employment for transgender women often leaves them with few employment options, including sex work. And we've already talked about all of the risk associated with the criminalization of sex work and how that applies also to transgender women. There was a study that was done in the United States, I can't believe it's 5 years ago now, called the National Transgender Discrimination Survey that looked at the experiences of 7,000 transgender women in the United States and reported on a lot of these experiences of stigma and discrimination and their association with HIV risk. So I wanted to just lay all that out before we moved on. I think Maurice and Daniela are going to focus their comments more on LGBT communities and maybe specifically MSM. So thank you for allowing me to have those remarks, and I look forward to our conversation.
Excellent. I think I'm doing a PowerPoint. Is it going to be shown? Okay. Excellent.
Yes.
That's a very good idea. Oh, excellent. So thank you very much to Pulitzer and the John Hopkins and Joanne for excellent introductions. And I'm going to try and be very quick because, like Tanya said, I really am interested in the conversation. So I'm going to be looking at homophobia and HIV from a Caribbean perspective with a little more narrowly focused emphasis on the situation in Jamaica. And so in 2011, we did the first ever research into the level and driver of homophobia in Jamaica. And we found that 82% of the population viewed homosexuality as morally wrong. This compares to the HIV prevalence rate among men who have sex with men, which is at 33%, or 1 in 3, which is, as I understand it, possibly the highest HIV prevalence rate among MSM in the Western Hemisphere. So the question was, why are we so homophobic? Well, we found from that same research that religion and popular culture play an important role in driving this homophobia. For example, the most effective way to drum up donations or offerings we find is to preach against homosexuality, because you can't preach against adultery or fornication because 85% of our population is born out of wedlock. You can't preach against alcohol or any of the other traditional sins because everybody's doing it. So, but nobody would confess to being gay, and that's done Saturday and Sunday in the church. And in Jamaica, everybody has to go to church. It's not an option. You have to go to church. And the musicians in our culture, they went to church as well. They sang in the choir. They imbibed this hate, and then they sung it. And then it permeates the entire culture because we're not a quiet society, as I like to say. There's music everywhere. And so Monday to Friday, you hear this kind of hateful rhetoric. We have the most homophobic songs in the world, over 200, calling for rape, murder, etc. of gays and lesbians. And then on Saturday and Sunday, it's reinforced by religion. So we are marinated in hate. And this is what it manifests itself. In 2012, we had a series of home invasions where persons were suspected of being gays, and people took it upon themselves to just invade their homes and eject them. And the police would show up and rescue the persons, but wouldn't arrest anybody. Okay, so even though their faces would be all on the national news, there'd be no arrests made. So there was a level of impunity, or there is a level of impunity. This is a particularly tragic incident, a 16-year-old youth. We have a chronic problem with LGBT youth, particularly trans youth in Jamaica, who have been kicked out because of their gender expression. In this case, Dwayne was kicked out at 14 by her father, and she lived in an abandoned building, and she decided to go to a street dance, public street dance, dressed as she identified, and a member of her church, female member of her church, outed her to the mob. They stabbed, shot, ran over Dwayne with a car, and then threw her body into the bushes and went back to dance. The police found the body the next morning, and there has been still no arrest. Okay. What have been some of our responses? Well, we've tried to do police LGBT sensitivity training because, as we said, the police will now respond to the attacks after the fact, but they will do nothing to actually arrest anyone. Right? So that just supports the impunity. We're also trying very hard to establish what is called Dwayne's house, because we still have a chronic problem with homeless LGBT youth. These kids who you're seeing here are sleeping in the sewers because they used to sleep in abandoned buildings. They were eventually kicked out. The buildings were torn down to prevent them from reinfesting them. And so this is where they live. They now all, or most of them, engage in sex work. They are paid extra for condom-less sex. And the last time we tested them, 90% were HIV positive. We filed some cases to challenge the anti-sodomy law. I can go through them in the question and answer. One, you've seen red, we tried to get the television stations to air a tolerance ad because we know visibility is important. They refused, but we did get the court to say, the court ruled against us in our challenge, but the court did say that the charter or constitution does protect the rights of gays, but just not in that instance. So there were some movements there. We also launched a challenge to the anti-sodomy law, but we had to terminate it because the youngster was getting so many death threats and was fearful for his life and was fearful for the life of his family. Okay, I've also challenged the law of Trinidad and Belize because both countries ban the entry of homosexuals, which is ironic because UNAIDS bases its regional headquarters in Trinidad. So the vulnerable populations can't legally go there. We also got some op-eds from some notable people because this one in particular was very chronic. The information on the conflation of homophobia and HIV was being misrepresented by our opponents, the fundamentalists, because some research done by Chris said that HIV was out of control in France and some other countries that had decriminalized. And of course, France decriminalized in 1792. But that's irrelevant to the homophobes. They just latched onto the fact that Chris said, HIV is out of control in France and they've decriminalized, so we shouldn't decriminalize because that's going to lead to an out of control epidemic. Of course, the flaw with that argument is that Jamaica has the anti-sodomy law, but we still have the highest HIV prevalence rates. So, and even in France, it's not 33%. Some of our results, we've gotten some positive editorials from newspapers. The Minister of Health has said some very progressive things, that the culture of homophobia, etc., is driving stigma and discrimination. But he hasn't done much other than that. We've also done public stands and visibility campaigns, which I'll talk about. We've gotten some backlash. The religious homophobes have been supported by imported fundamentalists there. We've seen a rise in the level of homophobia, religious-inspired homophobia, and we've had the largest anti-gay demonstration in our history just this June 29th, which was ironically the same day World Pride was happening in Toronto. And the media have been just horrific. So this Monday, just Monday gone, a new poll was released which produced these very startling findings. The level of homophobia has actually increased from 82% to 91%. And I can tell you that, we have the strategy to get rid of it. There is an ongoing review now of the Sexual Offences Act, and we're trying to get the government to repeal the law through the legislative process. But one thing that we think may work is we're beginning to get the straight population, the women, to appreciate that because of the law, because of the homophobia, men are being driven underground into false relationships because we think that homosexuality can be cured through regular straight sex. Okay? And We also have come to realize that 33% of the MSM population, 60% of the MSM population also have sex with women. So we're hoping that the women, because we have a female prime minister, will start to mobilize around that issue. Because in terms of human rights for MSM, it's not a priority in our country. Look forward to the discussion afterwards. Thank you. 8 minutes is right.
I know, right? It's so fast.
Can I adjust this down just a little? Hi everyone, my name is Daniela Zaltzman. I'm a photojournalist, and on and off for the past 3.5 years, I've been going to Uganda to document the LGBT human rights crisis that's ongoing. I'm going to try to be speedy, talking about generally the relationship that we should hope to build between the journalist community and the public health community, and then segue into some applications within my own work. So the first thing journalists have to consider when they start any story is access, particularly in public health stories when you're frequently looking at deeply stigmatized, criminalized groups of people. How do you get into their community as a stranger, as an outsider? It's incredibly difficult to get people to trust you, and there are a couple of reasons for that. One is that journalists in this day and age are widely distrusted, sometimes for good reason. And the other is we ask a lot from our subjects. You know, I show up at someone's home and ask them to tell me their deepest secrets, stories. I ask to photograph them at their most vulnerable, and then I want to broadcast that information to the entire world. If someone asked me to do that, I would tell them no, frankly. So I understand the reservations. But that requires that we gain trust and that we earn a level of trust from subjects that takes a long time. But there's a lot of synchronicity between what public health workers and journalists are trying to do. The problem is we operate by very different codes of conduct and standards of ethics. You know, for public health professionals, that revolves around confidentiality. For journalists, that revolves around not displaying bias and not looking to work as advocates. And so the question becomes, how do we cooperate? How do we collaborate to use the same kinds of access to achieve our different end results? In particular, one of the things that journalists really have to struggle to do is, if you look at the average medical journal scientific article, they're not accessible to the average reader. They're frequently very heavy with lingo, and it's very easy when you're working with a public health organization to become bogged down in that lingo yourself and start saying MSM instead of just gay men and men who have sex with men. So it's our responsibility to synthesize all of the technical information to really understand the medical and scientific subtleties, and then act as a bridge between technical treatments to something that's really accessible to the greater public. A lot of the impact of high-level medical surveys can frequently be lost when they're weighed down in jargon, and journalists need to be diligent and not rely on that when we create our own work. So I'm just going to speak briefly about some of these series. I've worked on a couple different pieces from Uganda. And for journalists, identity becomes the biggest question of safety. Public health professionals, when confidentiality is the greatest governing rule in public health work, how do then we cooperate because you can't tell a story. You can't tell a story of a greater systemic issue without telling a personal story. That's how people relate. That's how people want change. And so I'll just start by saying the first time I went to Uganda in 2011, I actually ended up working on the story by accident. I was on my way to Juba in South Sudan to document the independence of the new country, and ended up being stuck in the country waiting for a visa to go through. And it was shortly after David Kato, who is the first human rights, LGBT rights advocate in Uganda, was murdered. And so I reached out to the LGBT community and realized that the crux of the story wasn't, whenever you'd seen photos, it was of individuals. It was of this very core group of incredibly brave, incredibly defiant activists. But the crux of the story is love. It's being able to love who you want to love. And no one had photographed couples. No one had photographed what it was really like to live outside of activism. And so I spent a few weeks documenting about a dozen different activists and their partners, half of whom really just could not be identified, and making sure people understood what the risks were if I did publish the images, and making sure I had consent from everyone. But at the end of the day, after 2 weeks of doing this, I returned home and I realized I just wasn't comfortable showing any of these images. I was worried I would put these people's lives at risk, and so I sat on the photos for about 2 years, and they went nowhere. In December of 2013, Uganda's parliament, after 5 years of going back and forth on this anti-homosexuality law, finally passed it. So I went back and then really had to evaluate, well, how do I editorially tell this story, still making it personal, still relating it to individuals, but without using identity, because unfortunately Uganda's media has become very savvy at taking images and information from international media and using it against their own people. There have been multiple instances of tabloids running photos, names, home addresses, work addresses of people with headlines like "hang them," Uganda's top homos exposed, really horrible stuff. So there's a responsibility. Now, maybe 10 years ago, international journalists could come in, run a story in their home country and not have to worry about it spreading. But now the internet has broken those barriers completely. Everything is accessible to everyone all the time. So we really have to be mindful of telling a story without putting people at risk. And keeping in mind that there is accountability. You may leave a country and stop telling its story, but it doesn't mean that your photos stop having significance. A month later, after I was there, President Museveni did sign the bill into law. And so all of these people who'd been living in purgatory for that month that I was there suddenly found that they had to close down health organizations. This gentleman here was running one of the best providers in the country for young men. Annually, he would administer HIV tests, provide counseling for and medical treatment for roughly 500 young gay men a year. In the 6 months that the Anti-Homosexuality Act was in place, he saw 23 people, just to give you an idea of the public health impact. I'm going to speed through these. Again, just traces of life. This is one a lesbian, bisexual, trans organization that had to burn all of their paperwork, all of their documentation for fear of being raided by the police. They had names, they couldn't risk putting any of their members at risk, so everything went to a bonfire in the backyard, shutting down offices before being raided. This is actually the 3rd anniversary of David Kato's murder. And then the last thing I want to speak about is actually when, as a journalist, when you're trying to convey identity and when you're trying to come up with alternative ways of making people understand what a person's, something more than just a portrait, something more than just a photo of an activist. And this is a series that I've been working on for my past few trips. Thankfully, this past August, the Ugandan Constitutional Court actually overturned the Anti-Homosexuality Act. It was on a technicality, and so a lot of activists are very hesitant to declare it a victory because they failed to address the fact that it's a major human rights issue. They just addressed the fact that Parliament didn't actually have quorum when they passed the law in the first place last December. But nonetheless, it means that Uganda has now reverted back to the Penal Code of 1950, which, although it does criminalize homosexuality, is still much more lenient in terms of jail time. So this is a series of double exposures of some of the most prominent activists in Uganda, all of whom are very visible, are in the media on a regular basis, but just to show that really there's a responsibility to tell a story that they have to keep a part of themselves hidden to stay safe. Their lives are not safe, no matter when or where they are. And this is the one on the flyer. And that's it for me, and I'm looking forward to the discussion. Thank you very much. Those were wonderful presentations. I'm going to kick off the Q&A and then hand it over to all of you to pick up where I leave off. There's substantial overlap and then substantial distinctions in the way that academics, public health academics, that lawyers and activists, and that the journalism world, especially photojournalists, all address the same problem of stigma, discrimination, violence, and these particular at-risk populations. But I'm wondering for each of you, how do you try to use your work as a tool for addressing and ultimately, hopefully, even eradicating the stigma and the discrimination because of the ways that they harm lives, take lives directly or take lives indirectly by precluding proper prevention, treatment, and counseling for HIV. So how do you each see that you can use advocacy, and what are the restrictions, the limits imposed on you because of the forum in which each of you work, like impartial, neutral, and IRB protected science, or maintaining confidentiality, or protecting the lives of the vulnerable people that you're trying to use as your work. So how do you each try to employ your work to promote advocacy?
Sure.
You want to start?
In order.
In order.
I'll start with you, Tanya.
I think one of the beautiful things about science, at least in this country, is that it is well respected because there is a systematic way of collecting data. And as someone who does a lot of qualitative research, I would say more qualitative research than quantitative research, there's the benefit of being able to tell a story in someone's own words. And as an example, the gender identity protection law had been up in Maryland year after year after year and failed. And one of the things that was helpful about the results of my dissertation study, where I looked at stigma and discrimination against transgender people in Baltimore, was that we were able to present those findings to the legislature in Maryland as one of the reasons for passing this law. And one of the benefits of journalism is that there were unfortunately violent attacks against transgender women that took place before one of the votes for the law. And the combination, I think, of data and science, and then the journalistic reporting around what the real lived experience of transgender women, or the death experience of transgender women, was able to be able to work in concert to move the agenda forward in terms of gender identity rights.
Well, I'm trying to figure out where I fit half the time because I am an activist, I am a lawyer, and I'm an educator. So I often am toggling. But in the past year or so, I have come to the realization, as I say, you can't just adjudicate or legislate to eradicate hate. You also have to educate. So I initially thought that by simply getting rid of the law, it would allow persons to become more visible, and that would help to solve the problem. But when I presented the fact of the horrendous law or the impact the law was having on HIV to our Minister of Justice, for example, the response was, so what? Straight people are getting the disease as well. And I said, well, gays are vulnerable. We're being killed. Well, we kill straight people too. Gays are poor. We can't get jobs because of our orientation. We have poor people. It really didn't matter. Really did not matter. So the legislative angle was very weak. The adjudication has been challenging because people are fearful to come forward. So that is why we founded LGBTI Aware Caribbean, because we realized we have to start to educate people about what it is to be an LGBTI. And I'll just share one story and then I'll shut up. My husband and I, we deliver the course together to police. And when we start these trainings initially, he's an ex-cop and he'll talk about community policing of vulnerable people, blah, blah, blah. And then he'll just casually mention, and my husband. And that slides because they don't quite get it. And then the second time, he'll say it again, and then you can see an awareness building. And then the third time he mentions it, he has to literally stop teaching because that's when they get it. And then I stand up. And then the questions begin. So who's the top? Who's the bottom?
Subtle.
They're not. they're cops. And so we have to, at that point, we build it into the training session where we address all their questions in a safe environment. And they tell us afterwards that it's the first time they've actually met a gay person and said, that's the first time you've met a gay person. and they're able to ask their questions, and then it helps to demystify the whole issue. So I think the greatest successes I've had so far is in education, not sadly in the legislative and the adjudication front.
So I think journalists has a very tormented relationship with that question, and I have my own existential crises. But the problem is journalists are not and cannot ever be seen as advocates. Our job is to raise awareness, and we hope through that other people can use our work in the name of advocacy. But we, while it's impossible to say that we're completely removed from the issue, just the fact that I've chosen to report on this story, I think indicates that I feel a certain way about it. I will not express a bias in my work. And the problem is, in this particular story, in Uganda has been one of the most covered countries in the world when it comes to anti-gay legislation. As we've said repeatedly, there are nearly 80 countries in the world that criminalize homosexuality in some form, and yet Uganda takes up a disproportionate amount of the coverage. Part of that is because activists from the start were very savvy when it came to dealing with international media, and partially because of Uganda's relationship to the West has made it a key target for Western journalists. But my main hope is, covering the story in Western media for a Western audience, to me, that's not my goal. I don't want to get into this now, but the end result, you could say, of having Western governments then pull funding from the Ugandan government in response to criminalization law, I don't think that's a solution, and I hope that my work doesn't inspire that action. But I do hope that, now in the age of the internet, where you walk around Kampala, everyone's got a smartphone, everyone's on Facebook, Twitter, media that previously might have been inaccessible to entire parts of the country, everyone sees now. And, I had a story up on CNN earlier this year, and there were dozens of comments from Ugandans. So I know now that at least is pervading their media as well, and that is important to me, because right now journalists and the state of journalism in Uganda is dire, particularly when it comes to covering LGBT issues and covering them fairly and accurately. There's a lot of misinformation that's continuously propagated. So if just some small percentage of Ugandans see my work, and if that changes their minds in some small way, to me, that's the most effective use of my journalism.
I have one more question, but I will sit on it if there are others who jump in. So, yes.
I have a question for Grace Tomlinson. Your description of the role that the church plays in generating a lot of homophobia was really interesting but disappointing. Are there any efforts going on to work with the clergy or the church?
That's a very good question. So the home will start doing's house for the homeless LGBT youth. We actually have two clergy on the board from the United Church and the Anglican Church. They're not very popular denominations, but they are beginning to amplify their voice through working with the kids to say, look, we don't think that this is how Christ would have us treat kids, So it's they're beginnings. The more evangelical, no, we have tried. I don't know if Chris, with the work you've done in the Caribbean, if you've had any success, but they're literally tone deaf when it comes to this issue. It's very literalist. So we're trying to work with other groups that are more tolerant.
Yes. Yes, you.
I'm John Sawyer. I'm with the Pulitzer Center. And just on this question about the church's role, we have another project that's pending now that Kwame Dawes and Andre Lambertson are doing. And Kwame is from Jamaica, did a project with us on called several years ago on human face of HIV/AIDS in Jamaica. And he's doing a project now with Andre looking specifically at this question, churches grappling with the role they have played in the past and the role they might play in the future. One of the interesting things that's coming out of that is a number of churches, as Marie says, everybody's in churches, including members of the LGBT community, some of whom have come out, some have not, some of whom are now getting to come out in their church community. And that's leading to a level of engagement at the community, family, church level that had not happened before. And so you have some people, including among some of the evangelical churches, who are facing this in a way they haven't before. And I'm among
I'm very happy to hear that. Thank you. I look forward to seeing that.
Yes.
This question is targeted at Maurice, but I think the others might have interesting perspectives on it as well. What are your thoughts in terms of interaction with the role of outsiders on this issue? So you're Jamaican, so you have a very powerful voice, but as scientists and journalists, I'm sure, we constantly have to be aware that when we're working on an issue, that it can just reinforce that this is a Western idea. And how do you think about that and approach that when you're, recommendations, thoughts about that?
Well, as Chris has demonstrated, I'm sorry, I keep picking on you, sorry. If it's done in a very humble fashion, I mean, if you haven't read Chris's op-ed in response to the misinformation, you should. It's brilliant. It's how it's done, right? Basically, he alluded to the fact that he had been to Jamaica. He loves Jamaica. He's very disappointed in how his research is being misused. This is what his research actually says. And it was just beautiful. But there tends to be an approach, which regrettably is very finger wagging. Why are you so backward? I mean, get with the program. If persons from the global north were willing to admit that, we had these laws, we had these same kinds of challenges you're having. It took us a long time because of religion to get rid of them, but we managed to. And these are some of the benefits. We haven't solved all the problems, but these are some of the benefits to having done that. And this is what we commend to you, rather than we command you. There'd be a very different uptake and response. Because at the same time, you are thinking, well, I can't, as a liberal, I can't get involved because I might, disturb the work going on. The evangelicals are coming from the global north with their rabid messages. They're meeting with parliamentarians. They're meeting with government officials. I mean, they are there. So you can't disengage just because of some misguided belief that you make things worse. Dialogue with the local community and be respectful.
You're touching on what I was going to ask before, but from a slightly different perspective. Daniela's comments made me think about the importance of trust, of building trust. We know about it in public health research when we're dealing with vulnerable, marginalized communities, members of whom often have to live in, underground sewage pipes, but they have to be invisible. But for each of you, how large is and how do you confront the challenge of building trust in order to undertake your work, and recognizing that the first rule has to be, do no harm. I'll start with you, Tonya. Again.
That gives the other people time to think and formulate better answers, but that's okay. I'm willing to be the sacrificial lamb today.
Well, you're one of us, so I can
torture your
from the
colleagues.
School,
okay, great. I'll use the example of my the project that I did in Baltimore. Is that it takes a long time. So I moved here. I didn't know anybody in Baltimore, and I started working at the LGBT Health Center here, where there was a large trans clientele. And through my engagement in the community, I learned about the Transgender Response Team, which is a group of local advocates and organizations that meet monthly to talk about what kind of services and what kind of structural change is needed and how do we move that agenda forward in the city of Baltimore. And it was 2 years after that, after I had made those relationships, both personal and professional relationships, that I felt comfortable asking, talking with people in the community about what is it that was important to them, that they wanted to know, that I could use my platform at the university to help learn on behalf of the community. And I think it takes that. I don't think you can show up and then a week later have trust. And I think the second part that's important after that is once you've done your study, that you don't then just disengage from the community, right? You've got your data and you run off, and that's frequently what people experience. That you have a commitment to the community that you are working with and on behalf of to stay and to look at, okay, we've learned this. It identifies all these needs and gaps. What can I do in my role as a researcher or a journalist, but I guess not as a journalist, you don't do interventions, but as a researcher, to then move forward with interventions and to get funding for those interventions through studying implementation and things like that, and to to demonstrate your ongoing engagement with the community. I'm really an advocate for doing that rather than the sort of one-off kinds of studies. While those are useful, I think it's difficult to have trusted engagement in a community when you do it that way.
I mean, in the extreme example, we don't want to be involved in what is the commodification of the populations with whom we're working, right?
Yeah, exactly. And that's a very good point, because the populations I tend to work with, which I call the scary queens, I'll explain that in a minute. They've been over-researched, and they're getting very resentful of it, especially because journalists have come, done stories, have left, and their lives have not improved. So we have to explain to them that the reason we've had these stories done on the situation of for example, the homeless kids in the sewers is because we want to generate awareness so that we can then generate funds so that we can get a shelter for you, because the government has said repeatedly they'd like to, but they have no money. Well, it's more like, how can you justify to a population that's homophobic that you're going to spend money on a homophobic shelter, on a shelter for homeless LGBT youth when there are other people who are poor? It just wouldn't fly. So how do we gain the trust? Well, one, we stick with it. You just look, I'm going to stick with it. And this has been difficult in Jamaica because we do have a situation called the rich queens, like myself. Right? I have a job, I drive wherever I need to go, I am in a gated community, so I'm never really impacted by physical violence, psychological violence, but not physical violence. And then you have the scary queens, who are the ones who are poor, who are lower socioeconomic strata, who are trans, who are sex workers. They're the ones who are more vulnerable. And there has been a clear dichotomy between the two and how they interact. They really don't. They just don't cross that boundary. So I've kind of been a traitor to both because I was the one doing the documentation and seeing people having been abused, etc. And I just felt I couldn't stay comfortable anymore. So I've stuck with it, and they have been abusive to me because they need instant gratification. I mean, you're living in the sewers, you want to get out right now. I mean, this thing about waiting is a luxury that they can't afford. And as I was sharing with a young man yesterday, I didn't create the problem, so I don't feel responsible to solve it immediately. But I do feel that I must do the best job I can while I'm there advocating. And I just do that. I take the blows. I know it's not personal. They are just impatient, and I would be too if I was in their circumstance.
Yeah, and for me, I mean, the problem is, at least I think from a health perspective, when you come in, your presence and your function is both needed and desired. But in order, I think my work is important. I hope my work is important, but it takes a really long view to think of it that way. And especially when people view access as transactional, it's very, very hard to look someone in the eye and say, well, no, I cannot give you money because that goes against my code of ethics as a journalist. And no, I mean, I cannot guarantee that this will get you money, but it is my hope that someone who sees this work will then realize that you need help. That is what my end goal is. But no, I cannot guarantee, I cannot promise that will happen. So I'm sorry, I just lost my train of thought. Where are we going with this?
Keeping trust.
Keeping trust. And the first thing, as a journalist, the first and best thing you can do to prove to someone that you care about them, that you want to know their story, is to put down the camera, put down the reporter's notebook, and just sit down and talk and listen. Most of all, just listen. And that's the only thing. People, there are so many parachute journalists who they come in, they tell the story, they leave, you never hear from them again. And that's really, it's both irresponsible and it's you're failing to do your job. And just being able to build and maintain communication with your subjects, not only because they are part of, no story is finished. Every story, particularly this one, is ongoing. And it is your responsibility to continue to tell that story and to continue to be connected to these people who have given you so much. So that is our responsibility as journalists.
Thank you all. That was wonderful. Chris, last question? Chris?
One quick question for each of you. In public health, we tend to be more deficit modeling, looking at rates of disease and injury, yada, yada, yada. But in many cases, when we go into doing LGBT research and surveillance, those indicators actually aren't available. How do you then maybe get people to look at surveilling strength-based or resilience-based to see, so the community may have these problems, but it has these actual things in its place that help these people survive, and that
I have a quick answer.
That's perfect. Yes.
Well,
Quick answer.
my thoughts about that are that community-based participatory research is a really powerful way to do that, and that you can document the deficits that exist in the community that are caused by structural factors, and then use what you find as resilience to build interventions, to say these are the strengths of the communities, how can we build on that to address some of the problems and challenges that we see. And I think that's really being able to marry those two things.
I saw one other hand. I know we're tight on time because the next panel is behind us, so can I invite you to speak specifically to one of the panelists after, or is it a really, really fast question?
I'll make it as fast as possible. But how do you feel like elements of designs go into creating advertisement and creating ways to organize information for people who are not necessarily familiar with specific situations? So organizing information and creating aesthetically pleasing ways to organize information for people who may not be aware of issues such as HIV, trans issues, and things of that nature.
I think that's a you.
I thought it was a journalist question.
I think that very much depends on the market you're talking about. I mostly work for U.S. publications, and I feel like much of my audience is very familiar with both HIV, with LGBT human rights issues. When it comes to my attempts to reach a local market, to reach Ugandans, it's hard. People don't want to listen frequently. That's starting to slowly change in ways that make me happy. But it's couching and packaging information so that people will listen takes a lot of effort. In a strange way, Facebook and Twitter have been the best media for that in the past couple of years. Activists are incredibly good about propagating information that way, and it spreads instantly. And that's young people don't go to news sites anymore. They don't read newspapers, but that's where they will get information.
Hello.
I don't know if it's so much about advertisement, because again, much as in Jamaica and Uganda, activists have tried to run radio campaigns, TV campaigns, and they've been shut down by the government. But you can't shut down international media. There isn't online censorship the way there is in China. So it's that social media is frequently the best way to reach young people who may be able to stay open-minded, who may be able to be more open.
So we've started a conversation. I'm delighted that Tonya and Maurice and Daniela could be here to help start the conversation, and we look forward to the second panel to continue it.
So now I'd like to introduce our second panel, and this is on translating research into effective and accurate journalism. And we have three folks who are going to join us. First is Micah Fink, please, who's an award-winning producer, director, and writer in public health, international affairs, and environmental issues. Micah is the founder of Common Good Productions, and his films include the one that we saw here last night, The Abominable Crime, a Pulitzer Center-supported award-winning documentary that explores the culture of homophobia in Jamaica, and that also features Maurice. It kind of more than features you. You're kind of the star, or one of the leads. And just last week, the film won the inaugural Amnesty International Human Rights Prize at the Trinidad and Tobago Film Festival. He is joined by Greg Gilderman, who's the executive producer of digital video for the Weather Channel and an adjunct professor at the Columbia University Graduate School of Journalism. He's produced several documentaries, including The Real Death Valley, an investigation of the wrongful deaths of hundreds of migrants in a single county in Texas. And then third panelist is Cherie Schwartz, who's an HIV epidemiologist and a fellow in our Key Populations Program, the Center for Public Health and Human Rights. Cherie's been engaged in research related to the impact of laws on HIV prevention and healthcare outcomes, doing some very important work actually linking Nigeria's new and very discriminatory laws to biological health outcomes among key populations with viral load measures, which is really a quantitative and biologically validated measure of healthcare access, and that's a real advance in our field. She took on this role And she recently, actually just when she started with us, worked with local groups and the media in Jamaica on how to interpret and use scientific data. And this was the situation that Maurice alluded to, which was really after some conservative groups and leaders in that country had distorted our HIV research among MSM to bolster arguments in a very non-scientific and distorted way around basically insisting that Jamaica's homophobic laws stand as HIV prevention tools. And of course, they are major inhibitors to HIV prevention. So I'm going to join the panel and moderate this session. And I guess we will begin. We're going in order again.
Oh, boy.
You picked the hot seat.
All right. So I was a reporter and editor at the Daily Beast before I came to the Weather Channel, and I've always tried to view my mission as bridging academic research with journalistic audiences. So at the Weather Channel, I spend a lot of time thinking about creating emotional, personal narratives that connect people's stories to climate change. And while at the Daily Beast, I developed a research interest in heroin use in the United States. So I spent a lot of time hanging out with drug dealers and drug users, particularly in Philadelphia. So that led me to think a lot about HIV transmission, and I spoke to a lot of really interesting people. And this led me to Russia, thanks to the Pulitzer Center. The project I created was called Death by Indifference. I probably could have called it Death by Hatred. And it was about the absence of any sort of government-supported prevention measures for people who are HIV positive or people living with AIDS. And I guess we could look at a couple clips. Is that queued up at all? Mostly what I did was write, but I also brought a camera and just shot some interviews. And I think one of the stereotypes in coverage I wanted to break was, do you want me to do it? I can do it. Okay, hope it.
You see it up there in the corner?
Yes, I do.
Я, в принципе, уже забеременела в 2003 году первый раз. Но первой дочке ничего не передалось. Терапию ей давали, а вот маленькому передалось.
So I'm just going to stop this for a second. So I don't know if you guys have, there's like this sort of trope of a heroin user in Russia, and you always sort of see the same photo of like a person lying in a bed somewhere with like their arm hanging off and they're drooling or something. And, you know, I just thought it was important to show that, you know, the reality was nothing like this, and that there were other risk groups there and other people with stories to tell. So, so Irina is a parent, is a woman. She's not a male heroin user, you know, holding a syringe. So you can just watch a few seconds.
Домашняя более-менее. Родилась здесь, в Питере. Здесь родилась, здесь выросла. Лет до 18 я была вполне нормальным человеком. Домашняя более-менее. Не курила, не пила, ничего плохого не делала. После 18 у меня уже как-то жизнь начала меня заносить не туда, куда надо. Ну вот стала, как сказать, вышла замуж для начала. За человека, который сидел в тюрьме. И выходила замуж в тюрьме. И стала употреблять наркотики в 20 лет. Даже как мне казалось, что мне эта проблема не грозит, и мне никогда не будет зависимости. Я вот сейчас возьму и брошу в любой момент. Ну, то есть сама пошла, сама проверила, сама узнала и совершенно спокойно перенесла эту информацию. И мама, Царство Небесное, тоже, кстати говоря, родственники мои абсолютно нормально к этому отнеслись. Ну что делать? Значит так. Значит, так суждено было. Ну, я бы, не знаю, все по-другому бы, наверное, сделала. Ну, даже просто сами как-то все ушло куда-то. Там те же самые путешествия какие-то, там, посмотреть мир, там, не знаю, здоровье, во-первых, чтобы было, естественно. Вот, поэтому у меня даже вот теперь то, что на костылях эти передвигаюсь, неизвестно, буду ли я вообще ходить. Конечно, я потеряла и здоровье, И вообще, жизнь просто, ну, ее как будто не было, вот все вот. Просто жалко, вот мне, например, жалко упущенных вот этих 16 лет, которые просто, я не видела в жизни ничего. Я упустила, а теперь вроде как хочется все наверстать, а понимаю, что времени осталось мало. Не так уж много.
A lot of you probably know opiate substitution therapy is illegal in Russia. So you have this kind of strange network of Eastern Orthodox Church supported rehabilitation centers. And there's not really, this isn't really evidence-based treatment. It's sort of like by your own courage, you can quit this thing. And I spoke there, do I have another couple minutes? I spoke there with this guy.
Think of us as about thieves or as about, well, as about terrible people, and even not people, but something maybe even worse than animals. My name is Alex, and right now we are in the St. Petersburg Rehabilitation Center, where drugs and alcohol addicted people are trying to become healthy, trying to change their lives. I was 16 years old when I tried heroin for my first time, and of course I liked it very much, and from that time I became a heroin addicted person. People in Russia are used to alcohol addiction, but nobody thought about drugs for a long time, and no one knew what drug addicted people look like. I think that when we were young, we were growing in the country that was named USSR, and then we had no information about problems, we had no information about the world abroad, about countries abroad, about the life of people abroad, and then something had changed, and lots of new things appeared in our life, and drugs too, and so we made lots of mistakes, and then nobody told us how to manage with those mistakes too, and so that's the problem of lost generation, I think.
So 2012. So another group, I won't show the video, but I don't know if there's been talk about incarcerated populations. At one point, Russia, had an even higher per capita incarceration rate than the United States, so I was able to speak to a former inmate of, Russia's wonderful prison system. So mainly I was trying to just give voice to these folks, and just to kind of give a little bit of context for this as a journalist, it's very hard to sell an editor on this sort of thing. So I actually had to go during my vacation time to do this, and I had to receive support from the Pulitzer Center. So I'm hoping one of the things we can also talk about is, ways to sort of forge relationships between journalistic institutions in a school like this. So, and I'm interested in your thoughts on that as well. So thanks.
So I've been asked to talk a little bit from the perspective of a scientist. What are some of the challenges, tensions, and opportunities in dealing with the media and journalists? And I obviously don't have the level, the breadth and depth of experience that a lot of people in this room have from a scientific perspective, because I'm really early on in my career. But on the other hand, because I'm early into my career, at those early stages, I've had to think a lot more recently about some of these issues, because as public health professionals, we don't get training for the most part in how to deal with the media. And you're just kind of thrown into it, with a few pointers, stick to the messages, answer the question you want to answer. You don't have to answer the question that you are asked, but that's actually really hard, is what I've learned. Especially when you're dealing with issues like this, right? I mean, we're not talking about exercise, improves health outcomes, sleep deprivation is bad. We're talking about really hot ticket, hot button issues people are really passionate about, polarized on, and it's it's challenging to deal with the media, and I think we both see the opportunities that come with it, but also, stresses. And in terms of, my engagement with Jamaica and Nigeria, I will say that both of those situations I would classify as stressful for me. And, you don't want to say something wrong. And so I just outlined, I'll try and be brief, but just outlined what I thought a few of the key challenges were and what made it stressful for me, as well as some of the potential opportunities. And I think one of the first things that comes to mind is the terms of engagement. Sometimes people approach you and you don't know who they are, right? So if they call you on the phone, you don't know anything about this person. You may have never heard of the institution or organization that they're calling from. It's not necessarily someone from the New York Times that you're familiar with. And so this issue of trust, which I think is really like a theme that we've been talking about, also is on our part. Can we trust this person? How are they going to represent what we say? I might have a quote of, 5 paragraphs that are all about human rights and engagement and care, but there might be half a sentence in there that, if taken out of context, could be used in a harmful way. And I think that is extremely, daunting as a scientist. We have to be so careful with not just who we're talking to, but knowing who that is, so that if it's someone that may be unfriendly, that we choose our words very carefully. So that's, I think, one big challenge. Also, obviously, the format of engagement is something to consider. Whether it's an interview over the phone, or it's a live radio show, which might have a diverse set of people on it, and so with very different opinions. And so really thinking through, how you're going to, what formats you're comfortable with, and being prepared for them. People will ask you, even friendly journalists, because of X and Y in your research, then is it true that Z is also true? That can be challenging. You want to be an advocate, but you also want to protect your reputation as a scientist and your credibility and not go over the line. And I think it's very difficult to figure out where science stops and where advocacy begins, to try and push the issues but not push them too far. We work with, in Nigeria, for example, we work with local groups. And if I say something negative about the law, I'm saying something negative about the government, and that could put someone that we work with locally in harm's way. And it's obviously of paramount importance to me that my work is never actually causing someone harm. So those are some of the real challenges that I can think of quickly. But in terms of synergies, obviously there's a great opportunity. Micah, you said last night that people don't respond to data, they respond to human stories. And at first that kind of depressed me. I was like, it's so true. What am I doing with my life? I'm a quantitative researcher. But then again, I was thinking about it some more, and you became interested in some of these issues because you were aware of the data. And so trying to figure out how we can effectively get our data into the hands of people that will use it, and give the human story face. We can't, because of ethics and confidentiality and all these things, we can't just walk up to someone, when a new law is introduced and do an interview with them and then publicize it. We have to go through ethics committees, review boards, all of these protections, but we also can't respond as quickly as journalists and the media can. And so I think really figuring out ways to find synergies, and I think one additional synergy is the last point that we talked about a little bit on a call this week, is how can we work together to actually build each other's capacity. As public health professionals, give some training in epidemiology and health research, and so that there's a better understanding amongst journalists about what we do, but also, especially for us, giving us some training in communications and dealing with the media and building our capacity. I know for one, I would be very interested in a two-day workshop in these issues, and I think a lot of people outside of even what we do would be as well.
Great. I relate, Sherry. I've made most of my career, the last 20 years, working with scientists and working with sort of complex empirical research, and then translating it, or attempting to translate it, into a medium that actually can influence how people think about the world and how they behave in the world. I had the good fortune almost 10 years ago being part of the team that came here to Hopkins for ABC News for Hopkins 24/7, which the entire challenge, it was an 8-hour series to try to document and dramatize
the work of everyday doctors and practitioners and scientists in the range of all the things that you guys do. And I think I spent 5 months hanging out here in the halls of Hopkins, and was very fortunate to be able to do that.
I worked on that. It's very wrong, yeah.
So much of my work has been engaging with scientists and researchers. I just for context, I also spent the last 3 years working with Al Gore, working with the world's leading climate scientists to try to shape public perception, honestly, about climate change. And again, from that experience, I think comes what I said the other night, which is that facts and statistics, I think, do not influence people in a deep or profound way. I think we live in an age where people are inundated with facts and statistics, and as my children often ask, is that a true fact? And just the fact that my 8-year-old and my 10-year-old can ask that question, I think taps into the very deep suspicion that Americans in particular, but I think in a globalized society, have come to mistrust the production of facts, right? There are lies, damn lies, and then there's statistics, right? And we know that facts are manipulated. We know that facts are manufactured. We know that information is shaped and transformed by the people that are interested in influencing our behavior. And I think that's the other thing to be aware of as public health, as in the School of Public Health, is that we live in a society where people are constantly trying to influence and shape our behavior. We live in a post-capitalist society that is based on generating dollars by shaping your behavior. Do you want Coke or do you want Pepsi? Do you wear jeans or do you wear, Guess, whatever it is that you do? That is the atmosphere in which we all exist, and we've become very savvy consumers of information. Regardless of how sheltered we think we are, we're constantly being inundated by these messages. So my role, as I see myself as a journalist, is not to take sides exactly, but when it comes to epidemics, when it comes to large-scale public health questions, I don't think it's hard to choose which side you're on, the side of humanity or the side of a virus, right? I guess you can say there are two sides to that question, but I don't really think so. And I think that it is in everybody's interest, whether you're American or Jamaican or Ugandan, to create an environment where the spread of a deadly epidemic is constrained and reduced. And so I don't have a problem in trying to create effective public messaging that does influence how people think about these issues and how they behave. And I think if you take that perspective, then the question becomes, how do you start with the facts that you guys are generating? John Sawyer from the Pulitzer Center is in the audience. He gave me my first grant to do research on and reporting on Jamaica. And the reason we chose Jamaica, there was a grant for reporting on HIV/AIDS in the Caribbean. We had two choices. One was Cuba, which turned out to be very hard to get into, and Jamaica. And the thing that led me to Jamaica was somebody had just published an epidemiological study that said that 33% or 32% of the gay men in Jamaica had tested positive for HIV. So that fact is what created both that short series for PBS funded by Pulitzer and the longer documentary, again, funded by Pulitzer. But that fact was the origin of everything that we've done since then. Because upon that fact, you can then build an effective series of media, call it, because it's existed now in print and in pictures and in video and short films and long films. Around that single fact is the root of everything. And so I would just, a word to the researchers in the room, scientists are so frightened these days, I think, of being attacked. And we live in a very vicious environment where people are attacking you for political reasons, for religious reasons, for ideological reasons. And yet, if you become so shy as to not be willing to foreground what it is that you found, then your research will probably likely go nowhere. It is only through effectively communicating the essence of what you're discovering, and then I think for most journalists, you also have to hint at the directions towards which it leads. So 32% infection rate in Jamaica, led me into the cultural issues. And I think probably for you as well as for me, it's the cultural issues that really drive epidemics, and it's understanding those cultural issues that help to transform behavior. Just one last word I'll say, which is for those of you who saw the film that we showed yesterday, you'll notice there are no Western experts in the film. There are no white scientists. There are no, the entire film is structured around a community of people all related by the situation in which they coexist. And I think that ultimately creates a more powerful message both for the people within a particular population, but also for people watching it from outside the population, because the people in the film all speak with legitimacy inherently. And I think that's one way to slip out of the legitimacy, outside, external, internal question. I think you should let people speak for themselves with the awareness that as journalists, we have a skill set that enables people to speak effectively. And I think that's probably the secret sauce here, is it's not just enough to prop up a camera and have somebody speak to camera and say, hey, I have some voices. You know, as scientists, I think you need to recognize that there is a craft and a series of techniques and skills that allow people to engage with other people. And that's the work of the journalists, whether it's, you know, the photographs that we saw or, you know, videos or print. What we're doing is helping people who are often fairly inarticulate. And I'll include a lot of scientists in that category, to help them to communicate the things that need to be communicated. And many of them may not be factual. There should be a framework of fact, but the things that actually attract people's attention are the human stories, are the more universal stories, the stories that aren't going to go away because the news has moved on a week or a month later. And I think the strength of this film, which has been around now for a year and keeps winning awards and is soon going to be shown on PBS, is that it transcends the moment. And that's a quality that I think, you know, me as a producer, I'm striving for. But again, it moves deeper into the realm of human experience, which becomes a universal experience. And then through that, you can slip in some facts that may change behavior.
Thank you. So we'll open it up for questions. Bishop, please.
I'm a journalist turned behavioral scientist, so I'm super excited that this partnership has come about. My question is sort of piggybacking off of something that Sheree mentioned, which is sort of a training or a workshop sort of for people who are scientists, who are journalists, who are looking into building on this idea of stories being data, of health communication and storytelling being beneficial to health outcomes. And I'm just wondering, Chris, or anyone, if that's something like that is in the works for, I don't know, building on this partnership between Pulitzer and Bloomberg when it comes to training people on innovative techniques for dissemination or partnering in these ways.
Yeah, I mean, I think that would be a great idea, and I think everyone here probably realizes just how cruel the digital revolution has been to the journalism business in general. But the one opening it's created, and I was part of the Daily Beast when it was a startup and grew to an audience of 10 or 20 million a month, is that there is a very big appetite for something that's about 600-700 words. So while creating a documentary creates a lot of funding, creating multimedia requires, you know, basic camera skills. I mean, those can be taught, you know, over time, audio, that kind of thing. Learning how to take your idea and maybe open it with a compelling personal anecdote, even if you don't give the person's real name, and then maybe just giving in very clear, simple language a couple paragraphs of context. There is a big appetite for that, and it's actually a lot easier to reach a national audience with that kind of piece than it was 10 or 15 years ago.
First of all, thank you so much for speaking with us today. I had a really quick question. So Maurice mentioned that he realized the educational aspect of the work he was doing tended to be more efficacious than going through the legislative process. And so I was wondering, when you're working on your journalism, do you ever think about a specific audience you can direct it to in terms of somebody who's in power who could make some movement towards the cause? Or So it's interesting topic there. I was wondering if I could hear your thoughts on that.
Sure. Why not? I'm a filmmaker, and I'm a long-form filmmaker primarily. So that means I do television hours or features. Also do short-form stuff. I am trying to craft the work that I do so that it is both engaging and entertaining for a general audience, while also containing enough content and real factual information that for those who have the ability to act, they can act. And so one example of that is I did the first film on avian flu when the epidemic was first breaking out in Vietnam. We tracked the epidemic through the stages of epidemic growth. So from individual cases to family clusters, from family clusters to larger group clusters, and then ended it up with transmission to public health workers. All that happened, and then the virus receded. But the effect of that film was to convince the White House, they had a cabinet meeting a couple weeks later, to create a flu preparedness program. I think they gave $2 or $3 billion for the creation of a sentinel system and for flu preparedness. So a timely piece of journalism that frames the issues, and I think one should be clear about what that means. I mean, advocacy is a dangerous word in journalism, and I think I see myself in the role of trying to frame complex questions and give people a way to think through them in a logical and organized manner so that they can come to their own conclusions about how to respond to them. And that kind of work, I think, impacts a wide range of people, and those who have the power to enact or react tend to take it forward. But you're also, in a public health sort of way, you want to influence a very broad population of people. So you have to make it entertaining enough, you have to make it engaging enough, you have to make it narrative enough, so that even though you might not be a specialist or particularly interested, it captures your attention. And I think I keep going back to that because it is a competitive marketplace for people to see stuff. If they don't want to watch it, if it doesn't capture their interest, and going back to your question, how do you capture people's interest? I think it goes back to basic storytelling. You tell them a story, and you don't tell them all of it. You hold things back so they want to know more. And that's about structure, and that's about organization. But that's how you get messages like this out.
Yeah. Well, I was just thinking, when I was an intern at ABC News, it was still, long enough ago that would just be a major event if you had a story. One of these stories was on a network news broadcast. That would be huge. Sort of broadly, I think there are two tropes in journalism that if you're doing them, you don't have to worry too much about being accused of being a propagandist necessarily if you've deeply reported, and that's investigative journalism where you're sort of, traditionally looking for some kind of institutional wrongdoing, or explanatory journalism, which is explaining a complex problem. And I think both of us would agree that to do either of those well, you need great characters with compelling stories. But just in a specific sort of tactical way, the thing I think about what you're asking about a lot. And so for this piece, it was published on the Daily Beast, which has a very large digital audience. But I also wrote a long article for World Affairs Journal, which people in Washington read. Probably not more than 1,000 people read it, if that many. But those folks are influencers. And also put the videos up on YouTube. And probably would have used social media even more if I were doing it now. I would suggest always clarifying whether you're on or off the record, and never think that you can say after the fact, even if it should be totally clear that what you're saying was off the record ahead of time. And I don't know how you feel about this, but I've never let anyone read anything in advance, but I have shown films to ordinary folks, not people in power, and very occasionally, for factual accuracy, I've shown a portion of films. But people who've participated in a film as interview subjects. I've shown them the films to just, have them tell me whether I've made any mistakes.
Let me just answer that as well, because I have some experience in this over the years. And first of all, I will tell you that, yes, absolutely, you have to be abundantly clear up front. And good journalists, particularly who are, for example, in the HIV world, there are a number of people who've been covering the story for many, many years. You can be very frank and say, I'm not willing to speak about that. You don't quote me on this. This cannot be in the record, but I'll talk for you on sort of deep background. And it's important to be known as a reliable source for that kind of deep background and to build relationships with journalists in the field, because you can really have a big impact. And you can, for example, help people, which I've done a lot of, in figuring out what story they ought to be covering, right? So, that's an important part of the process, I think. And then you can be very much in the background. Nevertheless, none of that protects you sometimes from journalists and the media getting it wrong, right? Sometimes spectacularly wrong. So we just had an experience where I co-chaired with a wonderful colleague, Professor Adiba Kamarulzaman from the University of Malaysia, the new WHO guidelines on prevention, treatment, and care for key affected populations. So exactly what we're talking about today, right? Key populations. And in those guidelines, for the first time, WHO endorsed this new prevention tool, pre-exposure prophylaxis, as part of a comprehensive prevention package for men who have sex with men who would be interested in it as a preventive option, right? And let me tell you, blood was shed on the floor in Geneva getting to that consensus language, right? It's part of a comprehensive package. It is not a standalone. It is voluntary. It is, and we really, really workshopped that. And almost to a one, the media reports that came out after the WHO did their launch, by the way, 3 days early and not including either of the co-chairs, so, bad on them, bad practice, was the headline, WHO calls for all gay men to be on antivirals. Right? Absolutely not the case. And one for which the WHO was totally unprepared, backpedaled, big mess, and didn't have, in this particular case, the opportunity for the scientists who'd been involved in this to actually weigh in and work with the media on getting it right. So that is going to happen, and it's part of the blows of doing public health work. But I think part of the reality is, first of all, that these kinds of issues are of tremendous interest, as Cherie was saying. This is a high-profile issue, and people are looking for new hooks, new stories, new elements to this. And part of it also, of course, is that you have to maintain your scientific integrity. You cannot get involved in that, rising swirl of calls. So, we have been trying to carefully craft responses to that, to put out, again, what the guidelines actually say, to get the actual language out there. But it's also a reality that, people move on. Now that is not news. The news is done. The cycle was brief, explosive, totally inaccurate, and poof, it's gone. And now the work is about getting governments to understand what we actually said and trying to get this intervention used. So far, not a single country except the United States is implementing.
So I'll just throw in a couple thoughts, which is, yes, you should always negotiate the terms of your relationship with a journalist, whether it's off the record or on the record or what you want. You can certainly ask if you can see things. My answer would always be no. I've never shown anything to anyone, except I often have a group of people who are experts in the field who are not in the film take a look at it before I'm done to let me know if I've done something horrible or if I've gotten something terribly wrong. And so for every major project I've worked on, I have a small informal panel of advisors who who help me. And so that's a very valuable role people can play in the background, because as journalists, we certainly don't know everything. And in fact, most journalists know even less than everything. And so you have to really help them. So, you know, if whether they misinterpreted you or just misunderstood you, I think is an interesting distinction. And that goes back to how clearly you're communicating. And often in the academic scientific world, things can get so very carefully parsed, and the word choices are so important to you and to your community, because you don't want to take credit for something you didn't do, and you don't want to over predict what might happen, or, you know, it's such a careful parsing of words that goes on in the academic community. You just have to know that that language disappears immediately in the world of journalism. It just does, whether it's headlines or the web or whatever. You know, journalists are hired to communicate topics clearly, right? And so much of the ambiguity that exists in what you're creating just evaporates. And so you have to think about...
Are you hearing this tension here?
Yeah, and I think, you know, in a media savvy way, you would not only write it for your colleagues, but then you might even jot down 5 headlines, because you know it's going to get reduced down to 7 words, right? So what is the findings? What is the takeaway? What do you want the journalist you're speaking to really walk away with? And you'll find if you frame it, the chances of inaccuracy are probably smaller than if you let them frame it, or me frame it, or him frame it, right? Because we're not experts. This is not our, you know, we may have background in these matters, but we're not scientists and we're not academics. And so I would suggest you come up with a list of headlines for yourself, and in some ways that becomes a series of talking points, so that when you're engaging your journalist, you, like they say, good editorial writing, you tell them what you're going to tell them, then you tell them, then you tell them again what you told them. And that's how you get your message across with many journalists, I think.
It's a secret to good grant writing, too.
This is the part, this is the quote I want to use, I want to make sure I got it right. And I know the intention is that you don't ever do that.
Is it?
No,
are you sure?
Some
do. Are you, I was saying the whole work. Is that what you're, I mean, going back for quotes, and I was saying, and I think I may have disagreed with Micah slightly, that if, you know, there's an investigative piece we're doing about, you know, the people dying in the Texas desert and the Border Patrol's involved, and maybe they aren't responding to 911 calls as quickly as they should be. Certainly, I'm not going to show any pieces of that to the Border Patrol, but there's a very scared 911 operator, and, you know, maybe I'll show the clips to her of her interview, and reading back quotes, you know. But as far as showing a full written piece, I've never done that.
Well, I think now you're getting into the different genre of journalism. I'm a video, TV, film person, and so I have you on camera saying whatever you're saying. There is no question about you having said it and how you said it. So there it is. I don't have any doubt as to whether you said it, because there it is in front of me. The reason I don't do it is twofold. One is because people come up with the craziest stuff to respond to. You show them an interview, I don't like my hair, you know, or I can't believe you shot me holding the book, you know, with my left hand. I'm really right-handed. People, they go insane about things that have nothing to do with the content of the piece, A. Maurice, I don't think Maurice ever saw a frame of what we did, and it went on for years, right? Because what I'm doing is character-based, and I'm confident in my facts, and my facts are checked and double-checked and triple-checked, because it takes years sometimes for me to do my work. So I don't have a basic doubt about the accuracy of the material, and I don't want to get into a debate about how I'm representing you, because you're not, you know, I'm making a work about you, and that's part of the trust, is that I won't violate you, and you have to trust me with that to go forward. So it's a different, print journalism is different from video journalism. I could go on, but it's probably not worth going more deeply. Yeah.
Hi, my name is Doug Rose, and I'm a community activist here in Maryland. And I'm working on a lot of the issues that you all are working on kind of globally. I'm working on them locally. But I often find, just as a community activist, I'm fairly privileged, so I know some folks at Hopkins, and I know some journalists, and and so I get a certain amount of access to information and to assistance, but it's not really broad, and I find often I wish I had a better relationship with journalists, and I wish I had a better relationship with researchers. Sometimes it's as simple. Last week I was trying to get some information about what were the top 5 deaths caused by top 5 infectious diseases that cause death in the United States. And I'm Googling and I'm finding, I'm seeing a lot of data, but I don't necessarily know how to process it, and I can't find anything that exactly answers the question. And I'm like, where do I go for help? And here I am trying to make an activist point in an activist kind of arena. And I'm just wondering if any of you have ideas about how we could improve the relationship between both researchers and journalists and activists.
I love activists. Activists are often my point of entry into a community, but recognize that very quickly in the process we leave you behind. That, for me, the most important and ultimately most effective stories are those told at the grassroots with people who are really engaged on the ground in situations. And it's often the activists that have the question of how do you build trust. Usually you build trust with an activist first, and they check you out and they see what you've done and they see who you are. And then once you've met with them and earned that trust, then they usually hand you off to people within the community. And so the activists, I think, have a vital role in terms of connecting journalists. The researchers are really doing the big picture number stuff, which creates the foundation for the work. And then it's the activists who usually have points of entry into the community. And what you're doing is really introducing and handing off the journalist into that world. So for me, that's sort of the food chain. And, amongst the 3 of us is how the message gets first, the idea is created, and then the topic is generated, and then the piece is reported through community groups and through activists.
Can I just ask a question, though? Have you ever considered generating journalism, as a blogger or, yeah?
Oh, yeah, absolutely. And I use social media, and I have my own sort of broadcast systems, and I also have good connections with community media. But even in community media, they're not always sort of equipped to tell a very nuanced story or to tell a story with great clarity.
Mm-hmm.
And so I often wish I had better connections with mainstream media, people who could take these issues and really look at them in a bigger way than I'm able to or than the community.
I would suggest even, that there are generally fewer reporters than there were, but, I would actually connect with journalism students. Many people end up staying in the same city where they went to graduate school, and it probably sounds horrible and not as good as just call ABC or call the Baltimore Sun, but unless you have a sort of headline in mind and something that reporter can sell to his or her editor, it's really tough, and that person is getting so many emails for so many ideas and probably has so many responsibilities to be, writing 10 times more than someone in their role did a generation ago, that I would suggest forging the relationships with a younger group. And the fact is that they don't have to wait until they work for a big newspaper to get something out there. They might have a blog themselves already. So
and I would just add to that from the research perspective, just from the journalism perspective, we have a huge responsibility to the communities we work with. They're also our entry point anytime we come in to do a research study or new work. And so we know that that relationship has to go both ways, and that you have to be able to count on us to respond when you have questions and things as well. So, if you have someone that you know, email them, call them, and if they don't know the answer, they'll put you into contact with someone else. As long as there's some sort of entry point so that the person responding understands who this person is that is emailing them, I think for the most part we're pretty responsive. And I think, obviously someone like Chris, I don't even want to think about how many emails you get a day, even though you still are very responsive, I have to say. But, and also maybe thinking of younger people who aren't getting 1,000 emails in their inbox every day.
But to Micah's point, you probably have the best stories. So, and anyone who's committed to journalism is going to recognize it if they talk to you for 10 minutes. So,
and also if you do what he was suggesting, which is create some media that suggests to the world what you're doing and what you know, because most journalists, I think, now begin with a Google search and say, I want to do something on HIV/AIDS in Baltimore. You might just type in HIV/AIDS activism Baltimore or HIV/AIDS Baltimore, and see what pops up, and you may well pop up in that. And I think that goes again to you as activists or as researchers. How do you communicate what you're doing? I think if you can manage to put a human face on it, if you can find that anecdotal story, if you can get the trust of the people that you're working with to the point where they are willing to be public, as researchers, you can identify people who are willing to tell their stories for whatever reason, whether it's because they just love to talk, or whether because they have a message they want to get out, or because they're brave and willing to stand up and represent their community or their population. There are always people like that. That's part of what makes us so interesting. And that's another thing that you as researchers and as scientists and as community people can do is, not everybody is an equally good interview. Not everybody is an equally good character, right? And print is, again, different from TV. But I think we all know when somebody's compelling. And, just register that. Say, hey, this person is really compelling, and this person is really articulate, and this person might be willing to speak to somebody someday. And when the journalist does come knocking on your door, you say, hey, yeah, I've got 3 or 4 people in mind that you might want to come out and meet. And that's how the game begins. And whether, they're coming to you as a researcher because you've just discovered something amazing in terms of some demographic or some statistical discovery about who's doing what where, for the journalists, and we live in an entertainment-driven world, so even the New York Times, almost everything is a character-driven feature now, right? Look at the Ebola coverage, right? What is that about? It's about individual case studies, right? They just hounded the poor man's wife and mother to death, right, to get the story about where he was and why he came from Liberia and all the rest of it, right? We love character-driven stories. It's what makes the media work these days. And so think about that, and even to the point where you might be a character, right? And what does that mean? And how much of yourself are you willing to share? How much of your process are you willing to share? How much of your uncertainties? People love stories of insecurity. I didn't know if I'd find something, but I decided I'd plug away for 15 years, and then you know what? I invented the LED. Woohoo! Right? People love stuff like that, and that's what the media does. Is we sell stories about people doing interesting things, ultimately.
Jackie, did you want to say something? Oh, now you're drinking.
I was just curious about sharing your work in Jamaica, because that was outside of your traditional role as an epidemiologist. Is that right?
Well, so I wasn't doing research there. I was there really to help. I went and visited a workshop and participated as like an epidemiologist to sort of present data from our group and try and help interpret it and help understand like how what the research and evidence really does show, because a lot of it had been misconstrued.
So this was after kind of things had gotten misinterpreted.
Yes, yeah, it was actually kind of in response to that. And so there were people from Ministry of Health and local community groups there. And I think they were feeling a little bit disappointed and flustered at how something that was meant to, should give them strong evidence to move forward with had been used against them, and really wanted some help to sort of think about like, well, what does the data really show from a scientific perspective? How, how is it misinterpreted, and how can we interpret it correctly? Yeah, I mean, can I just ask a question?
Please.
So
most of what we do is like, we sit at computers, we work on these publications that, as someone else mentioned, are very challenging for some people to read through, not written in layperson's terms. And then sometimes you guys pick it up and come to us, right, to cover it. Is there a different role? Like, what is our responsibility as scientists in coming to you as the media? Is there, when is it appropriate? When is it inappropriate? When does it cause you to feel like, that it's an agenda?
I don't know. I'm always excited to get a great story idea, and I can't say I've ever been emailed by. Well, I got, in response to the Russia story, I did get some response, but I don't think they were thinking in the terms that I was thinking, which was, here is a big problem, and here is an incredible person, which, maybe that perfect situation is never there, but or is rarely there. But I do think you need to figure out who is doing responsible work in your field, and those are the people who would be receptive. And just because someone has a byline on a health story, that's maybe not even a good sign at all. But if they've written something that you respect, that's probably someone who's going to want to hear what you have to say.
I think also it depends on what you have to say. I mean, if you're saying, hey, there's this amazing new angle on a story that hasn't been told before, that lead line, if you all write it down, is how you get a journalist's attention. Here's something new about something that we all thought we knew but we didn't, right? That's journalism, right? That's the beginning of the conversation. If you're saying, hey, I just want to tell you something that has been out there for many years and everybody keeps saying it but it hasn't been communicated well, that's a more challenging approach. So you have to think about how you present what you're doing.
But folks like you, Mike, like I'm thinking of this piece. What really got me interested was listening to a Yale epidemiology podcast where they talked about drug users getting their driver's licenses revoked once they have to officially register as drug users in Russia. I was like, well, what the hell is that about? And I ended up writing to the guy, Robert Heimer at Yale, who's done a lot of work in St. Petersburg. And if they hadn't done that podcast, I never would have been fully inspired. So by just sort of putting work out there, and a podcast is an hour of hanging out and talking. That's how that idea came to my attention, and that scientist came to my attention. So you're probably always looking for stuff too, right?
I am. I read science. I read a lot of different magazines and things, and I'm interested. So but you have to put it out there.
Yeah.
And you have to put it out there in a way that even we can understand.
Yeah.
Yeah.
Maybe last.
Hopefully very quickly for Cherie, we talked a bunch about how medical professionals can have workshops and learn to better work with journalists, but conversely, I think journalists who frequently work with health stories have a responsibility to learn how better to work with medical professionals. And are there things that you wish, and this is for Chris too, are there things you wish journalists would do more? Are there things that would make you more likely to respond to open inquiries from journalists who are poking around, maybe not yet well educated enough or well informed enough, but looking for better information, looking to you as a resource?
Yeah, that's a good question.
Yeah, I'll give a little bit of a longer view because I think this has really changed. There was, when I really started my career, there were a number of mainstream, particularly print journalists who covered HIV. There was Larry Altman at the New York Times, who was really a thought leader in the field, and it's down to John Cohen at Science. I mean, there is literally one print journalist who, from that whole cohort, really, who is on top of it in some ways. So that has really changed. And what you find is there are many, many more media outlets. You have much more informal relationships. There's many, many more stringers. There's obviously much more media, and there's all kinds of new media. And there are fewer of the kind of journalists who are, staying on top of our story. So that is a real change, because it feels like often you're sort of inventing the wheel, and you can't have the same kind of conversation with somebody who has been working on HIV for as long as you have, So it feels to me like it's really changed. And getting back to the idea, as we're coming to the end of our time, about what kind of training would be really helpful. I'll speak for myself and say that figuring out how to navigate as a scientist this new media space is very important. because it's changed and changing very, very quickly. I mean, you all know that, and I find it challenging. I think it's a very different environment.
You know, just to throw in there, if the funding and the timing were available, I would recommend we get a bunch of you guys together and have you make a story, because there is no better way to know what the needs of a journalist are than to actually do it yourself. And it's not, it's not that hard, frankly. And I think that would probably be the best possible training, because to actually have to think about what is the headline, what is your lead, how do you shape this story, you will come to realize, we work in a fairly limited form, most of us. And if you can present information to us in a form with which we are familiar, you're much, much, much more likely to get a story out there.
And just a really quick suggestion for you guys to think about. John Jay College of Criminal Justice has something that's really just wonderful that I attended, which is 2 days. It's an invitation to, well, actually you have to apply and you get a very small grant, a few $100 or something. But it's 2 days of seminars that they put on, bringing in criminologists from around the country. And it's for about 50 journalists, and it's over 2 days. And I got a huge number of story ideas from that. So that was sort of you guys educating journalists in a very concentrated way about what you're working on.
Well, so, okay, last question.
Well, as a communications person who works here, I have felt like the answer to a lot of these questions would have been like use your communications skills. That's what we're here for, is to help you, navigate the relationship between the scientist and the journalist. And a lot of us are trained. We're trained in journalism schools, and kind of know a bit about journalists a little bit.
I'm giving you my card. I want to hear what's going on here.
Yeah, I think you're a gateway. I mean, I've worked with a lot of public information officers, I have to say, and it's a mixed bag, because most institutions are more committed to defending their identity and their reputation, and it's a more reactive thing, is my experience in working with public information folks. It's not about generating new story ideas. It's about promoting a very particular and often very narrow line. So, I mean, I think in terms of the scientists, they should come to you to ask you how to shape your stories and what the headlines are and how to frame them. But as a working journalist, I tend not to go to public information folks at institutions unless I really want to work with that institution, in which case you're the best place to begin. But usually you get very quickly handed off to senior administration because you're frontline and they are institutional usually. But I think, for you guys, in terms of what short-term training you can do, I would turn to them and say, here's an idea, here's a topic I'm working on, how do you frame it? And that's probably the quickest way to get there.
Are you going to bring us home, Maurice?
We're very quick. This is totally perhaps off topic. I used to work in this university business development unit, and so I was also always inundated by situations where researchers have run too quickly to journalists with ideas, and the repercussion was that they lost, copyright, patent, trademark, etc. So I'm not sure how you negotiate that here at Johns Hopkins, because you don't have such cutting-edge stuff. But I think it's something to consider when you think about how do you rush to a journalist with a good story. I've had to be on the receiving end of that. It's not pretty. Clawing back information is obviously possible.
Let me just ask about, there's a reception after and on the Wall of Wonder, and directly after this. So everyone's invited to the reception, which is right after this, out in front of the Wall of Wonder. And let me just say, I think this was really a wonderful conversation. I really appreciate both this panel and the panel before. And I think we heard a real enthusiasm, some hunger out there, and some interest in continuing this dialogue and doing some more of these kinds of training. So consider yourselves enlisted in the cause, and please join me in thanking our panelists.